All right, Crystal, now over to you.
Okay, we will take it from here. Thank you, Michelle. The Great American Smokeout is today. In fact, our Kendall Nunley was live from the Bodies exhibit, giving us kind of a first eye view, or really a hands-on view, of what body parts look like for someone who's been smoking compared to a healthy person. Well, the nationwide effort to get people to stop smoking for a day began in 1976 with the hope that people will give up smoking completely. People thinking about quitting and need extra motivation or help, Nevada offers a tobacco quit line. That 1-800-QUIT-NOW. You can even request a free supply of nicotine replacement patches, gum, or lozenges. And so this is a very important issue, and we have two very special guests who are with us today. November is Lung Cancer Awareness Month, and this is really a devastating disease, lung cancer being the leading cancer killer in both men and women in the U.S. So we have two people joining us today in studio, Jennifer Campbell.
Yes.
And also we have Sinamaram Abanonu. Did I get it?
Pretty cool.
Okay. Well, thank you so much, both of you, for being here. You know, I really want to talk about the significance of getting the word out. You know, can you give us kind of some stats or, facts about just how prevalent lung cancer is and how deadly it really is amongst our general population?
Certainly. We see about half of all smokers will die from some kind of smoking-related illness. Okay. So, and certainly, and then about 70% of smokers actually want to quit smoking.
Sure.
So using the Great American Smokeout as that opportunity really gives smokers a chance to take a stand and commit to quitting.
No, absolutely, because we know it will lead to ultimately healthier lives. Yes. And longer lives as well. And so, healthcare partners really stepping up to really be a part of this effort and try to get the word out. So, can you kind of tell us some of the things that you're doing in the community to get people to kind of make that change? Because it can be really difficult.
Yeah, through healthcare partners, the comprehensive total care model offers patients the benefit of having a dedicated group of healthcare providers who work in collaboration to manage patients' overall health. Right. Through readily available access to healthcare records, providers, primary care providers, and specialists have the most up-to-date and accurate health information on their patients that they're seeing. And that allows the providers to optimally manage the patient's overall health and well-being.
So really trying to get this process as streamlined as possible so that you can get these patients the help that they need so they can ultimately make that change in their lives. So any kind of closing remarks that you would like to share with our viewing audience, as November is Lung Cancer Awareness
Yes, ma'am.
Yeah.
If you are faced with a cancer diagnosis, please reach out to the American Cancer Society. Yeah. Talk with your physicians. But there is support and help out there for you. And if you're somebody that wants to fight back against lung cancer or any other types of cancer, you can get involved with our Relay for Life events. They're great community outreach opportunities.
Oh, absolutely. You all have really been at the forefront of trying to make a difference and trying to, do something about cancer in our community and across the world,
yes,
to be quite honest with you.
Yeah.
So we thank you two so much for being with us. And with that, we're going to send it over to Michelle.
All right, thank you. This weekend